So this is the 90-90 hip shift or scissor shift. So I'm laying on the right side, and I only do this laying on the right side. This is to balance out the pelvis. So the pelvis neurally lives as if it's like that all the time. So the pelvis is sort of like that. It's not vertical, it's actually living that way. So this is to help get the pelvis back to neutral by taking it back the other way. So I start off with my knees and hips at 90 degrees and my feet touching surface. So touching the wall here. And I just sense my feet touching, especially my heels, particularly my heels touching. And I'm just sensing, I'm just feeling that. It's nothing more than that, just feel that it's there. So it's a sense of groundedness through the legs. I've put a ball, so a small ball that you can squeeze. You pop that between your knees. That is a bit too small even here, the trigger point ball, and it's too hard for starters, but just for the idea of it here. So pop that between my knees. And I'm keeping my lower back rounded here. So I would have taught you the knack of how to keep that round. Even when I pull my hip back, I want the lower back to stay rounded. I don't want it to arch or go into extension this way. I don't want it to arch at all. So often when people pull the hip back, the body wants to arch. We don't want that, it stays rounded. So from here, I take a breath in through my nose and out through my mouth. So in through the nose, and I pull the hip back, and I breathe out, and I squeeze down. So I feel this left adductor work a lot, and as I breathe out, I mean, when you get all the air out, and especially connecting the ribs down into the pelvis on this side, so the left zone of apposition is being connected here. And I hold for a count of 3. Then when I breathe in, I don't let the knee come forward one bit. So I keep it back. As I breathe in, I see if I can pull it back even further by using this adductor. I'm not letting the body roll back at all. It's just the pelvis itself, letting that roll back. And then as I breathe out, push down into the ball again, and breathing out. And feeling this come closer. These points come closer. As I breathe in again, pull the hip back further if I can, still keeping rounded and not letting my body rock back. It's just the hip. And squeezing down again. All the air out, hold for a count of 3, then letting it off. And I repeat that 3 times. So 3 breaths, 3 times. Other way I can do this is to let the shift come back each time. So I'm breathing in, pulling the hip back, breathing out, squeezing. So I'm squeezing downwards, getting this connection here. So getting all the air out. And then as I breathe in, just letting it go. And then I breathe in again, pull the hip back, breathe out. Squeeze down. I'm trying to get the hip back a bit more each time, again without rolling my whole shoulder back. And if you're doing it that way, you aim to do three sets of 5 breaths with that. And doing 1 to 2 times a day is good to help get the pelvis back into neutral here.